Welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, we will go through 20 NCLEX practical nurse multiple choice questions and answers. If you like this video, please share it with your friends. Let's begin.
61. A client with diabetes mellitus has a blood sample drawn for the determination of a fasting blood glucose level. When reviewing the client's results, the nurse determines that which requires a call to the healthcare provider for intervention. 1. 75 mg/dl. 2. 92 mg/dl. 3. 120 mg/dl. 4. 240 mg/dl. Answer. 4. Rationale. The normal fasting blood glucose level is 70 to 100 mg/dl in the adult client without diabetes and 70 to 130 in the client with diabetes. Values above the normal range should be evaluated to determine if further intervention is needed. The most critical value is 240 mg/dl. 62. A client with a history of gastrointestinal bleeding has a platelet count of 300,000 cells per milliliter. Which action by the nurse is most appropriate after reading this report? 1. Report the abnormally low count. 2. Report the abnormally high count. 3. Place the client on bleeding precautions. 4. Place the normal report in the client's medical record. Answer. 4. Rationale. A normal platelet count ranges from 150,000 to 400,000 cells/3. The nurse should place the report that contains the normal laboratory value into the client's medical record. The remaining options are incorrect and unnecessary. 63. The nurse is reviewing the serum magnesium results for a group of clients. Which results warrant a call to the healthcare provider by the nurse? Select all that apply. 1. 1.2 mg/dl. 2. 2.0 mg/dl. 3. 2.6 mg/dl. 4. 3.0 mg/dl. 5. 4.2 mg/dl. Answer. 1, 4, 5. Rationale. The normal magnesium level in an adult client is 1.6 to 2.6 mg/dl. Magnesium levels that are below or above the normal range should be reported to the healthcare provider. 64. A client has a history of mild renal insufficiency. Which serum creatinine level should the nurse determine is consistent with this problem? 1. 0.6 mg/dl. 2. 1.1 mg/dl. 3. 1.9 mg/dl. 4. 3.5 mg/dl. Answer. 3. Rationale. The normal serum creatinine level is 0.6 to 1.3 mg/dl. The client with mild renal insufficiency would have a slightly elevated level, which would be the value of 1.9 mg/dl. Creatinine levels of 3.5 mg/dl may be associated with acute kidney injury or chronic kidney disease. 65. A client with a seizure disorder is taking phenytoin, Dilantin. A sample for a serum phenytoin level is drawn, and the nurse determines that the next dose of the medication may be administered if which laboratory result is noted? 1. 17 mcg per milliliter. 2. 21 mcg per milliliter. 3. 24 mcg per milliliter. 4. 27 mcg per milliliter. Answer. 3. Rationale. The therapeutic range for serum phenytoin, Dilantin, level is 10 to 20 mcg per milliliter, so the next dose of phenytoin should be given if the level is 17 mcg per milliliter. If the level is too high, such as in the remaining options, the client could experience phenytoin toxicity. 66. A client with hepatic cirrhosis has been consuming a diet with optimal amounts of protein. The nurse determines that the client's consumption of dietary protein has been most effective if the total protein level is which value? 1. 0.4 grams/dl. 2. 3.7 grams/dl. 3. 5.4 grams/dl. 4. 6.8 grams/dl. Answer. 4. Rationale: the normal range for the protein level in the adult client is 6 to 8 grams/dl, which makes the value of 6.8 grams/dl the correct choice. The remaining options are all low levels and do not indicate that the diet has been most effective. 67. A client was diagnosed with acute pancreatitis 10 days ago. The nurse interprets that the episode of acute pancreatitis is fully resolved if the serum lipase level drops to which value? 1. 135 units, L. 2. 175 units, L. 3. 200 units, L. 4. 250 units, L. Answer. 1. Rationale: the normal serum lipase level is 10 to 140 units, L. A client who is recovering from acute pancreatitis usually has elevated lipase levels for approximately 10 days after the onset of symptoms. This makes lipase a valuable test for monitoring the client's pancreatic function. The serum lipase level of 135 units, L, indicates resolution of the acute pancreatitis because it is a normal value. The remaining options identify elevated lipase levels. 68. A client arrives in the emergency department complaining of chest pain that began 4 hours ago. A troponin T blood specimen is obtained, and the results indicate a level of 0.6 nanograms per milliliter. How should a nurse correctly interpret these results? 1. It is a normal level. 2. It is a low value that may be indicative of gastritis. 3. The level is indicative of a myocardial infarction. 4. The level indicates the presence of possible angina. Answer. 3. Rationale: troponins are regulatory proteins that are found in striated muscle. The troponins function together in the contractile apparatus for striated muscle in the skeletal muscle and the myocardium. Increased amounts of troponins are released into the bloodstream when an infarction causes damage to the myocardium. A troponin T level greater than 0.1 to 0.2 nanograms per milliliter is consistent with a myocardial infarction. A normal troponin I level is less than 0.6 nanograms per milliliter, whereas a level greater than 1.5 nanograms per milliliter is consistent with a myocardial infarction. A troponin T level of 0.6 is not normal, so that option can be eliminated. Troponin T does not test for gastritis or angina, so those options can also be eliminated. 69. A client has a hemoglobin level of 10.8 grams/dl. The nurse interprets that this result is most likely the result of which factor in the client's history? 1. Heart failure. 2. Dehydration. 3. Iron deficiency anemia. 4. Chronic obstructive pulmonary disease, COPD. Answer. 3. Rationale: the normal hemoglobin level for an adult female client is 12 to 15 grams/dl and 14 to 16.5 for a male client. A low hemoglobin level usually indicates anemia. Iron deficiency anemia can result in lower hemoglobin levels. Heart failure and COPD may increase the hemoglobin level as a result of the body's need for more oxygen carrying capacity. Dehydration may increase the hemoglobin level by hemoconcentration. 70. The nurse determines that an adult male client admitted with dehydration and a hematocrit level of 56% has received adequate fluid volume replacement if which repeat hematocrit level is noted? 1. 48%. 2. 54%. 3. 60%. 4. 64%. Answer. 1. Rationale: the normal hematocrit level for an adult male is 42% to 52%. Thus, 48% is the only correct choice. The client who is dehydrated has an elevated level as a result of hemoconcentration. The client's level may be expected to drift back down to within the normal range after the fluid volume has been adequately restored. The remaining options are too high and indicate fluid replacement is still indicated. 71. A client is having problems with blood clotting. Which food item should the nurse encourage the client to eat? 1. Legumes. 2. Citrus fruits. 3. Vegetable oils. 4. Green, leafy vegetables. Answer. 4. Rationale. Green, leafy vegetables are high in vitamin K, which acts as a catalyst for facilitating blood clotting factors. Legumes are high in folic acid and thiamine. Citrus fruits are high in vitamin C, which helps with wound healing. Vegetable oil is high in vitamin E, which acts as an antioxidant. 72. When reinforcing instructions to a client with acute diverticulitis, which should the nurse include? 1. Avoid whole grain products. 2. Limit fluids to 1,000 milliliters daily. 3. Increase intake of seeds and nuts. 4. Increase intake of raw fruits and vegetables. Answer. 1. Rationale. Diet therapy for acute diverticulitis involves allowing the bowel to rest by avoiding high-fiber foods, such as whole grain products and raw fruits and vegetables. Fluids are encouraged rather than restricted. Seeds and nuts are to be avoided so that they do not become trapped in the diverticula and cause irritation. In non-acute stages, a high-fiber diet may be prescribed. 73. A client is a lacto-vegetarian. Which food item should the nurse remove from the tray? 1. Eggs. 2. Milk. 3. Cheese. 4. Broccoli. Answer. 1. Rationale. Eggs are not consumed by lacto-vegetarians. Other dairy and plant products are eaten by lacto-vegetarians. 74. A low-sodium diet has been prescribed for a client with hypertension. Which food selected from the menu by the client indicates an understanding of this diet? 1. Baked turkey. 2. Tomato soup. 3. Boiled shrimp. 4. Chicken gumbo. Answer. 1. Rationale. Regular soup, 1 cup, contains 900 milligrams of sodium. Fresh shellfish, 1 ounce, contains 50 milligrams of sodium. Poultry, 1 ounce, contains 25 milligrams of sodium. 75. The nurse is providing dietary instructions to a client with gout. The nurse should tell the client to avoid which food item? 1. Scallops. 2. Chocolate. 3. Cornbread. 4. Macaroni products. Answer. 1. Rationale. Scallops should be omitted from the diet of a client who has gout because of the high purine content. The food items identified in the remaining options have negligible purine content and may be consumed by the client with gout. 76. A clear liquid diet has been prescribed for a client with gastroenteritis. Which item is appropriate to offer to the client? 1. Soft custard. 2. Orange juice. 3. Clam chowder. 4. Fat-free beef broth. Answer. 4. Rationale. A clear liquid diet consists of foods that are relatively transparent. Soft custard and orange juice would be included in a full liquid diet because they were opaque, not clear. Clam chowder is opaque and also includes pieces of clams, thus eliminating it from a full liquid diet. 77. A client with heart disease is instructed regarding a low-fat diet. The nurse determines that the client understands the diet if the client states to avoid which food item? 1. Apples. 2. Cheese. 3. Oranges. 4. Skim milk. Answer. 2. Rationale. Fruits, vegetables, and skim milk contain minimal amounts of fat. Cheese is high in fat. 78. The nurse reinforces instructions to a client to increase the amount of riboflavin in the diet. The nurse should tell the client to select which food item that is high in riboflavin. 1. Milk. 2. Tomatoes. 3. Citrus fruits. 4. Green, leafy vegetables. Answer. 1. Rationale. Food sources of riboflavin include milk, lean meats, fish, and grains. Tomatoes and citrus fruits are high in vitamin C. Green leafy vegetables are high in folic acid. 79. A client with a burn injury is transferred to the nursing unit and a regular diet has been prescribed. The nurse encourages the client to eat which dietary items to promote wound healing? 1. Veal, potatoes, gelatin, and orange juice. 2. Chicken breast, broccoli, strawberries, and milk. 3. Peanut butter and jelly sandwich, cantaloupe, and tea. 4. Spaghetti with tomato sauce, garlic bread, and ginger ale. Answer. 2. Rationale. Protein and vitamin C are necessary for wound healing. Poultry and milk are good sources of protein. Broccoli and strawberries are good sources of vitamin C. Peanut butter is a source of niacin. Gelatin and jelly have no nutrient value. Spaghetti is a complex carbohydrate. 80. The nurse has completed diet teaching for a client who has been prescribed a low-sodium diet to treat hypertension. The nurse determines that there is a need for further teaching when the client makes which statement? 1. This diet will help lower my blood pressure. 2. Fresh foods such as fruits and vegetables are high in sodium. 3. This diet is not a replacement for my antihypertensive medications. 4. The reason I need to lower my salt intake is to reduce fluid retention. Answer. 2. Rationale. A low-sodium diet is used as an adjunct to antihypertensive medications for the treatment of hypertension. Sodium retains fluid, which leads to hypertension secondary to increased fluid volume. Fresh foods such as fruits and vegetables are low in sodium,